Do bladder relaxants impact your brain? Imagine taking a medication to help with bladder control and wondering if it might also influence your mental clarity. That's a valid question, especially since some bladder medications can affect brain function. Let's explore how these drugs work and what their effects on the brain might be. Bladder relaxants, mainly called anticholinergic drugs, help manage overactive bladder by blocking a chemical messenger called acetylcholine. This messenger signals the bladder to contract. When these drugs block it, they reduce involuntary contractions, helping you feel less urgency and frequency. Common medications include oxybutynin, tolterodine, darafenicin, solifenacin, trospium, and fesotrodine. The key concern about their impact on the brain depends on whether these drugs can cross the blood-brain barrier. This barrier protects the brain from many substances circulating in the blood. Some bladder relaxants, especially oxybutynin, can cross this barrier more easily. Studies using imaging techniques have shown oxybutynin enters the brain in a dose-dependent way, which means higher doses lead to more brain penetration. Other drugs like solifenacin and tolterodine have moderate ability to cross, while darafenicin, fesotrodine, and trospium tend to stay out of the brain because they do not cross the barrier as easily. When these drugs reach the brain, they can interfere with acetylcholine's role in memory and thinking. This can lead to side effects like memory problems or confusion. However, it's important to understand that research results are mixed. Some studies suggest a link between anticholinergic use and cognitive decline, especially in older adults, while others do not find a clear connection. This means the actual impact on cognition varies from person to person. Choosing the right medication can help minimize risks. Drugs like trospium and darafenicin, which have less ability to cross into the brain, are often preferred if cognitive side effects are a concern. If you notice any memory issues or confusion while on these medications, it's crucial to talk to your healthcare provider. They can help decide if a different drug might be better suited for you. In addition to cognitive effects, these medications can cause dry mouth, constipation, and sometimes blurred vision or rapid heartbeat. Usually, it takes several weeks for the full benefits to kick in, and any side effects should be monitored closely. It's also interesting to note that bladder control involves complex signals between the brain and the bladder. Brain regions like the prefrontal cortex and the midbrain work together to regulate urination. Because of this connection, medications that influence brain chemistry can sometimes affect bladder function, and vice versa. That's why some newer treatments explore brain-based approaches for bladder issues. Overall, the decision to use bladder relaxants should be made carefully. For many patients, especially those with serious bladder conditions, the benefits of symptom relief outweigh the potential risks to cognition. But it's always best to discuss your specific situation with a healthcare professional. If you experience any changes in memory or mental clarity, report them promptly. Remember, personalized medical advice is key to safe and effective treatment.